In this patient, this is the lung. Okay, this is ventilating without the PEEP. If you see here that alveoli, the lung is opening during inspiration and the collapsing during the expiration. Okay, this is the normal ARDS lung. Okay, so see here what happened when I add the PEEP. What I add the PEEP to this patient, what happened here? My alveoli are expanding during inspiration, but it's not collapsing during the expiration. This is the when I applied the PEEP. If I remove the PEEP from this patient, what happened here? See here, this lung is expanding during expiration. If I remove the PEEP, what happened here? See here, my lung is expanded, it's collapsed again. Okay, what will happen here? If example, if I didn't apply the PEEP, the normal lung will go for the during tidal volume, it will be oxygenated. Other lung, the partially collapsed will be, it's going for opening and closing. It will open during inspiration and collapse during expiration. It will cause atelic trauma. Okay, if I give excessive PEEP to the patient, what will happen? This is my lung. Okay, this is normal alveoli. This is partially collapsed. This is completely collapsed. Okay, if I give PEEP, it's not opening my partially collapsed alveoli. What will happen? This goes for the over distension. It will be over distension. If over distension will cause increased stress and strain, it will cause the ventilator induced lung injury. What is stress riser? There is some part of the alveoli are collapsed, normal, some part of the alveoli will be collapsed, okay, partially collapsed. There is a junction between this alveoli, this junction between these two alveoli, the pressures will be multiplied, the stress will be multiplied. For example, if it is a lung is more inhomogeneity, which means some part is collapsed, some part is partially collapsed, some part is normal ventilation. What will happen? The junction between the partially collapsed or collapsed alveoli or partially collapsed and the normal alveoli, the pressures will be multiplied because of the heterogeneity. It causes the more lung injury. So, if it is the ARDS lung, if I ventilate the ARDS lung without PEEP, what will happen? That partially collapsed alveoli will go for the during inspiration it is open up and expiration it is collapsed. It will cause atelic trauma. If I give there is some of the normal alveoli in the baby lung alveoli will go for the over distension. It can cause the valley trauma, stress and strain. That is because of the heterogeneity, the pressure will be multiplied between the partially collapsed and the normal alveoli. It also cause lung injury. Okay, so we can't prevent this lung injury by the PEEP. Sometimes if inappropriate PEEP, it worsen it can cause more strain, valley trauma, over distension. If inappropriate PEEP can cause more over distension, it can cause worsening stress and strain. Sometimes if our PEEP may worsen our heterogeneity, it can cause worsening of the stress riser. So the PEEP may be sometimes benefit, sometimes it may worsen your ventilator density lung injury. So PEEP has other effects also. It can cause hemodynamic compromise. It can raise your CVP. If very high PEEP can compromise the renal function and gut function also. Okay. So first thing, what will happen if this is my ARDS lung, if I set the PEEP to that. Okay. I told that 3 types of the alveoli, if you see 4 types of alveoli, you will see in the ARDS. The first one is the normal alveoli. Okay. This is the non-dependent part. This is the normal alveoli. The second 2 alveoli are, one is the loose alveoli, which means that the airways are collapsed. Some of the alveoli will be some of the air in the alveoli. That is, one is the sticky alveoli. This is completely collapsed. Okay. Fourth one is the consolidation. The consolidation because it's filled with the alveoli are filled with the water or solid material. What will happen? This is the consolidation. This is the sticky atelectasis. Okay. This is a loose atelectasis, the normal alveoli. Okay. What happens, see here, the consolidated, I cannot, whatever the pressure, it won't open because it is filled with the solid material or liquid. Only our aim is to the role of PEEP in ARDS to, it's prevent the over distension of this alveoli to have to open this alveoli for the better oxygenation and the complaint. I have to open, I have to avoid over distension. Okay. This part, this consolidated alveoli, I cannot do anything because whatever the pressure, I cannot open that alveoli. Okay. See here, if I give PEEP to this patient, this alveoli is expanded. Okay. This alveoli can go for the over distension. Okay. The same PEEP I said to the one patient, some of the alveoli will be normally open up, some of the alveoli go for the over expansion, over distension. That is the reason it is very challenging to set a PEEP in